Selena Gomez, 105.1 The Buzz. Dari, Mitch, and Ted here, and we welcome to the studio our friend and cosmetic surgeon, Dr. Michael Workman.
Doc?
How we doing?
We're doing great, Dr. Workman.
Doing excellent. Right.
So let's go back in time a little bit, and we'll find out a little bit about you. We know you pretty well. We've known you for years, but just for the sake of new listeners or people that don't listen, every other Wednesday. Where did you go to medical school?
University of Minnesota.
Okay, so that happens after regular college, right?
Yep, 4 years undergraduate degree.
And then when you're in college, do you have to major in like biology
or
medicine, pre-med?
You have to be pre-med. All pre-med means is you've taken a year of physics, a year of biology, a year of chemistry, and then you have to take the MCAT examination, which is this tough test. And then if you do well on both of those, you interview and get accepted into medical school.
All right. So did you know that during the time that you were pre-med and entering medical school that you wanted to focus on plastic surgery?
I didn't.
Okay. So you just learn blanket medical things.
Correct.
Before you then decide, I'm going to work with feet or.
Right.
Okay.
What's the easiest field?
Dentistry.
Podiatry. There's got to be one that's easier than the rest.
I think they're all difficult. I really do. I mean, it's there's a saying. There's no
it's
such
dentistry.
I didn't say that. No, I mean, there's no such thing as minor surgery. Only minor surgeons.
That's true.
Good
No,
point.
I mean, you can't let your guard down when you're taking people's lives in your hands ever.
Correct. What a good diplomatic answer.
Well, it's the truth.
Put that on your business card.
It's the truth. Yeah.
So I want to ask you something that's just like that you should know just from your medical know-how. If you cut off your finger, are you supposed to put it in milk?
Or ice.
Ice.
Ice?
Are you sure? What about I've heard that you're supposed to you need to know this, because what if you accidentally slice off a thing, like you're getting up there in years and then somebody wants a little thing and you're like, boom, off goes a finger. Yeah, or more,
Mitch really.
I really need to know this.
a more likely scenario.
Mitch
cuts off a finger. Now I've heard, and a dentist would know this. if you lose a tooth too soon, like if a tooth gets knocked out, you put the tooth in milk.
Yes.
And then you go to the place.
Probably any liquid, I'm guessing. But there's probably nothing special with the milk.
No, there is
there
something special. It's a calcium.
Well, for one quarter, Dari, I was going to be a dentist, so I think, I may know better than you about that.
Is this all brand new to you?
1 quarter.
Like, have you never heard that if you lop something off, put it in milk?
Maybe for a tooth, and I'm no dentist, remember?
I remember.
But the traditional thinking on fingers, oftentimes we'll get finger replants. We would just tell somebody to put it on ice and keep it with the patient and bring it in.
What is the importance? Why would you put it on ice, though?
Because you want to slow down the degradation and the death process of the finger. Basically, you want to freeze it. You want to shut all the metabolic stuff down.
What about if an eye gets gouged out?
Ooh. Hot sauce.
Milk?
Salt.
Oh, my
Salt.
gosh.
Pack it in salt.
Yeah,
before,
no, I
even
don't think
before,
so.
if you think your eye may be
Go
gouged
ahead and
out,
put salt on there.
pack it tightly in salt.
I think ice is
and
good there, too.
you're laughing. Okay.
How do you get the eye out?
Like with a spoon. It's been scooped out with a spoon.
It's been scooped out with a spoon.
Your head
or
got squeezed.
like a melon baller.
Oh, a melon baller. Okay.
Yeah, or head in a vice.
Head in an elevator door.
And they're like, tell us what we want to know. And you're like, and then both the eyes would go at once, I
Or
imagine.
Uma Thurman from Kill Bill has plucked it
Well,
out
there
of
you
your
go.
head
Yeah.
whole.
There you go.
Just
lean
into this little configuration I'm making with my fingers. I'll show you how it's done.
Don't do it.
No, you're so trusting. See,
Well,
we have no salt, ice, or milk
Or hot
here.
sauce,
So
nothing.
really,
I'd
I
be
had
in
some
trouble.
Orange Crush. Hopefully we would have to
that looks
preserve
good.
here. How are you doing?
I'm doing all right. I'm doing all right. Now that I flunked my pre-med exam.
Oh, I have one more question. One more
Yes,
question.
yes.
We had a fact earlier today that's claimed.
Fact.
What are you
What are you
doing?
doing?
I'm giving you the F.
What are you doing?
The F sign. Fact.
He's making it up.
That's not an F sign. What are you
Like a
doing?
gang
Stop doing
symbol.
that. Are you trying to do sign language? This is an F, my friend. I don't know what you're doing. It looks like you're about to squish someone's head from a distance.
If you include his arm,
Oh, I
It's
see.
an F.
It's making
It's
it
an F. I'm trying to.
Oh, my
nothing
God.
fancy here. It's just an F.
Happened.
I see now. Makes sense
Sorry.
to me.
How about like this?
The claim was, don't you poke me in the eye. The claim was, when you do a kidney transplant, they don't take the old kidney out. Is that true? They
do.
What?
They do take the old
Are you
kidney
sure?
out?
Are you sure? Are you sure?
Boy, when I was doing kidney transplants at the University of Minnesota, we'd take the old one
Then
out.
you actually have done that procedure, though.
Yeah,
Okay. All right.
yeah. Well, I've assisted on it.
Okay.
Yeah,
Good.
I remember flying on a Learjet from University of Minnesota down to Las Vegas John Wayne Airport, and we did a harvest on a cadaver, and we took the liver and 2 kidneys out.
Wow.
Put them in the ice cooler, no milk, no salt, and flew back to
Left
University
the
of Minnesota.
body in the ice in the tub
Ice
full
bathtub.
of ice.
Yes,
Yeah.
yes, of course. And then we flew back to University of Minnesota. And we put and there was a team waiting there to
Wow.
put the liver and the kidneys in.
That's awesome. That's exciting.
Yeah.
Yeah.
There's some
something.
cool stuff going on out there.
So a plastic surgery question. Finally.
Yes.
Finally.
Finally.
You
As,
made it.
as you know, yes. As I'm sure you know, on Real Housewives of Beverly Hills, Yolanda Foster had to get some breast implants removed because there was a silicone leak. They were old implants. Have you had to remove implants before that maybe someone had someone had received somewhere else and then they ruptured? Have you ever done that procedure?
Yes.
Can it just go all over in there?
No.
Oh.
No, it's urban legend. And, I mean, I tell patients that implants are just like a shoe or a tire. It's a man-made product. At some point, they're man-made products. They are going to wear out. So that, you just, if you're younger, need to expect they'll need to be changed in 20 to 30 years, most likely with the latest silicone implants. But what happens and what a lot of people don't get is the body puts all this scar tissue or a shell around the implant, just like it does around a pacemaker, so that if there is a kind of a breach or a rupture in the shell of the implant, that silicone is well contained in that same area. It does not go throughout the body, and that's urban legend.
So you're telling me that Kyle, Lisa Vanderpump, and Lisa Rinna were correct. She is exaggerating. That's Dr. Michael Workman. Listen, it was a smooth running train to me that went logically from track to track to
I
track
was
to track
following
to
along.
track
I
to
liked
track.
it a lot. It was a good ride.
You can check out Dr. Workman's website at drmichaelworkman.com. He performs procedures, everything that you can imagine plastic surgery-wise, from the neck on down.
Yep.
Specializes in body augmentation, whether that be breast implants, breast augmentation of other types, breast lifts, and also liposuction and other procedures to streamline and tailor your body to be the best it can be. Dr. Michael Workman, drmichaelworkman.com, the website. Thanks, Doc.
All right, thank you.
Go Seahawks.
Yeah, go Hawks.
All right.